Okay, so we're doing the TRT lab final, and we're going to start by having proper patient positioning, making sure she's centered on the table from her coccyx to EOP, and then making sure the tops of her shoes or the tops of her feet are at the edge of the table. And I will clear the display, do the FLLR, and we're going to say that her right leg is a short leg. So I would have her turn to the side a short leg, and if it evens, this is wrong so I have the patient go back to center, and then this would be a C1 lateral with or without torque. So I would pressure test initially the lateral TP, and then if that balanced the legs, I would then do clockwise or counterclockwise torque to determine the torque, and based on that I would adjust with the integrator straight lateral to medial on the Atlas TP. Alright, and then next, after doing that, I would clear the display, and then check the FLLR again, and then have the patient turn to the opposite side now. And if this balance, it's cervical syndrome, go back to center please. And then I would check C1 posterior torque at the posterior TP of C1, or C1 posterior rotation, and then after I determined that balance, I would do clockwise, counterclockwise torque, and depending on that torque, I would then go straight posterior to anterior at C1. And if C1 didn't work, I would then go to C5. Posterior TP. And then I would check for torque clockwise and counterclockwise, and then adjust straight posterior to anterior to see if that balance. And after that, I would check for what's called bilateral cervical syndrome, and basically when the patient is turning to the opposite side, or I have her do the turn test, can you turn to his right, and then the left, and then I find that her short leg switches. So then I would go to occiput, and I would be looking for a posterior occiput. So find the EOP, and on the side of, I would press posterior to anterior, and then try and check for torque clockwise, counterclockwise, and based on that I would go posterior to anterior and inferior to superior with head motion on the occiput. And if that didn't work, I would then check the coccyx by doing a pressure test like this. And then there is no torque on the coccyx, and then I would set it by tissue pulling. Jen, I'm just going to contact the bone you sit on. So find the coccyx, tissue pull, and I would be going as low as I can, and it would be inferior to superior and anterior to posterior. And then after that, I would do the sphenoid immediately by pressure testing with her face down. So it would be superior to inferior, inferior to superior, anterior to posterior, and posterior to anterior. And then to adjust that, I would, oh, by the way, there's no torque on the sphenoid. I would have her turn her head towards me. And for this one, I will show you superior to inferior. So find the lateral canthus, a little bit lateral, and then try to be as level as possible. And then I'm placing my thumb here to apply a little bit of counter pressure, and that would be straight superior to inferior. All right, after that, I would check C5. Then I'm checking for pressure testing, posterior to anterior and inferior to superior. And then checking for torque, clockwise and counterclockwise. And then I would adjust at the lateral TP, posterior to inferior, or posterior to anterior and inferior to superior. And then after that, I would check Oh, I'm sorry, that was supposed to be at the spinous. And then after that, I would check C1 posterior tubercle pressure testing. And then I would adjust C1 posterior tubercle. I would adjust P to A, I to S based on torque. Oh, but I would have pressure tested here at the posterior tubercle. So P to A, I to S, like that with torque. And next is T6. So I would find and palpate T6 and pressure test. And based on that, I would go to the T6 spinous process and go inferior to superior and posterior to anterior. And last but not least for bilateral cervical syndrome is C1 lateral. So I go to the C1 TP, pressure test lateral to medial, find counterclockwise or clockwise torque, and based on that I would adjust lateral to medial. And that is then a priority 2.